Lisa, this is Dr. Dukes. Our microphone's working now. Right now the camera's in the back of the shoulder, looking towards the front. Again, this is November 4th, 2010. And the camera's in the back of your left shoulder with the probe coming through the front. This is the humeral head, which is the ball and socket joint. Very smooth cartilage. Everything looks very healthy here. This is what's called the glenoid, which is the socket. Sometimes there may be a little bit of surface damage right here, and maybe a little concerning. There's sometimes a central thinning area. This may have been what we saw in your MRI, but this is clearly abnormal. This is the posterior aspect. You see this loose cartilage right here. This is the torn labrum. And then you actually have a flap of labrum here. And this tear extends all the way up into here. This is the anterior front part of the shoulder. And this is what's called the anterior inferior glenohumeral ligament complex. This keeps your shoulder from dislocating. And I don't see anything too bad here. You actually see a little bit of cartilage debris that's floating around in your shoulder. We'll clear that out. Sometimes there's a normal opening here called the sublabral foramen, and that's what we're seeing here, and that's very normal. So what I'm going to do is clean this up right here, and then we'll see about repairing some of this, if it needs to be repaired, or if we can just get by with cleaning it up. Again, that's the biceps. As we turn the camera up here, this is the undersurface of your rotator cuff, and it looks perfect. This is the back side of your cuff. That's a nice look at this damaged cartilage back here. This is clearly a significant problem here. At least what we've done is we've just roughened the bone where this labrum is supposed to be attached. We've passed a suture around the labrum. We'll use that to anchor it back down. I'll show you some more pictures of that in a second. See? Lisa, this is where we've repaired the top part of the labrum. And you see this is nice and stable here. And our suture's holding it in place. This is the biceps tendon. So we're going to put the camera through the front and look towards the back. And this is what we want to see. We want to reproduce this little bumper effect here. We have the camera looking from the front towards the back now. This is where we repaired the labrum up top, up higher in the back side. And so what I'm going to do now is clean this up, and I think we're going to need to repair some of this in the back as well. But you can see where this has kind of gotten beat up back here, Lisa. And we've already smoothed it out a little bit, but I think we have a little bit more work here. You have a little small defect here that's small. I wish it wasn't there, but it's significant. It's just indication of some of the pain and injury that you had. Lisa, this is a final look. These are the anchors up top. Here's the ones directly in the back side. See, we've smoothed that defect out. Now we're nice and stable here. Again, just that mild surface damage there. Most people tolerate that very well on the shoulder because it's a non-weight bearing joint, but this should take care of it. I think that's a good outcome from what we had to start out with. So we're going to look on top of the shoulder, and I'll show you some more pictures in just a minute. Lisa, this is what's called the subacromial space. A little bit of inflamed tissue here and some bursa. We'll take that out and just take off that little bone spur in the front. This won't be too involved. I'll show you some more pictures in a second. This is the top side of your rotator cuff. And this is some of the fraying that we saw in your MRI. I don't think it's a big issue. Out here, it looks much more smoother. So we'll gently smooth out that rough area and take off the bone spur. This is the chromium that we've taken off this bone spur in front. And so we're about finished here. We're just looking at your shoulder from a little bit different view. This is looking directly down on top of the rotator cuff. So we'll clean up that little frayed area and we'll be finished up.